Good afternoon. Thank you for watching our live briefing for Thursday, June 11th. Today, I have a brief update on the COVID situation here on campus. Then, as promised, I'll provide you with a brief outline of step 4 of our next steps plan, which kicks off Monday, June 22nd, assuming we continue along with some good outcomes here. After me today, Sarah Abernathy will share some updates from the arts program. Then Lynne Mcclintock will introduce our Thoughtful Thursday segment for today. In terms of the situation follow-up with assisted living, our second round of testing is back for the Avalon residents, and thankfully everyone's test came back negative. So this morning, quarantine was lifted for the residents of Avalon, and that's a wonderful thing. The second round of testing for the Gables and Monticello residents and those staff will occur on Saturday. Once those results are back, assuming they're all negative, we'll again lift the quarantine for that area. In terms of Parsons Health Center, we continue to work towards getting a baseline test. We continue testing all the staff in Parsons Health Center. So far, all the results we've gotten back have been negative, and for that, we're very thankful. Early next week, we'll be testing the rehab department and our Westminster Canterbury Richmond at-home staff to round out the healthcare team. Now let me talk briefly about step 4 of our next steps plan today. I'll just talk through the highlights. We'll talk more about them next week. This step will begin Monday, June 22nd. You already heard from Scott earlier in the week about the opening of the Promenade Dining Room for breakfast and lunch. Details are in this week's Tales. Hopefully you have a chance to look at that. Also starting the 22nd, we will be ending. Also on Monday, the 22nd, we will be ending our pantry service. Jason Pace from Dining will be here tomorrow to share the details of that. We also, starting on Monday, the 22nd, plan to reduce our live briefings from 5 days a week, which we've been doing now for 6 weeks or 7 weeks. We're going to trim it down to either 2 or 3 times a week. Not sure exactly yet. We'll announce a schedule for that next week. The big thing, besides the Promenade Dining Room, that we'll start, or we'll be prepared to start on June 22nd, is the introduction of some structured and safe visitation for everybody on campus. This plan and its implementation is contingent, obviously, on no new cases and quarantine. Quarantine really makes visitation impossible for anybody, so if we have cases, we'll have to work through that. As we've learned, new staff and resident cases cause quarantine, which makes it very difficult from both a staffing standpoint and getting access to residents, nearly impossible. So we may have some stops and starts, and we just need to expect that going in. And I think if we all anticipate that we may have some stops along the way, we'll be okay. It may be frustrating, we understand that, but some of this we can't control. We have to respond to. And so we'll be responsive. We may need to pause or suspend things for a week or two. Hopefully not, but if we do, just be prepared that could happen. So for visitation, we will begin to roll out options for off-campus visitors for each area of living. First, independent living visitation will begin by appointment only on Tuesday, June 23rd. Whitney and others will share the details of how you and your loved ones can make appointments and how this process of bringing folks into campus and into a visitation space will work. We're still working through the finished details, but we have a good plan, and Whitney and her team will be sharing those with you next week. Assisted living visitation, all if all goes well, will begin Monday, June 29th. Sloan and her team will be here next week to share with you and the plans for that, but we have a plan for how that will work. Parsons Health Center, we have a plan and a space that's been created, but we are awaiting guidance from the Centers for Medicare and Medicaid Services and the Virginia Department of Health how we get approval to do that. At this point, as you know, probably if you've been watching these, CMS has closed all nursing homes in the Commonwealth, well, nationally, until such time as they create a plan that allows for reopening. We haven't gotten that yet, but as soon as we get the approval, we will move forward with visitation, and we'll be ready to begin as soon as we can get permission. I was on the governor's task force call today, and the task force has submitted a request to the U.S. Department of Health and Human Services to get their assistance with creating that guidance and creating a process that facilitates the reopening. There's a couple of states ahead of us in line, Maryland and I don't remember the other, Pennsylvania maybe. And so the 3 states have gone in to try to get some help from the federal government to move that process forward. As soon as I know more, and Will Blackwell knows more, we'll communicate it. Hopefully, we'll be able to put a date to that soon. Today, that was really what I wanted to do, is just give you a preview of those things that are coming. Next week, you'll get much more detailed information, both in writing and through the live briefings next week. But I do want to just say one more time, at the risk of repeating myself, if the situation changes and we have positive cases on campus, these plans may need to change or be paused. That's just part of our plan to be responsive, is we need to expect that that might happen. Hopefully not, though, but we'll keep plugging away. Next week, like I said, you'll get more details on all these plans. Lastly, I'll be off tomorrow afternoon and Monday, so Deborah Jacobson will be your host for the live briefings for both Friday and Monday at 3. And I will see you next Tuesday. That sounds kind of good. So here's Sarah.
Hi there. I am the Visual Arts and Program Director here, and I wanted to give you a little information about our arts program. Starting next week, the Arts and Pottery Studios and the Woodworking Shop will be open Monday through Thursday from 9 until 4. It will be a similar format that we've had over the past 2 weeks. There will be places available for a total of 6 people in the art studio and 2 residents in the pottery room. Tables and chairs will be spaced apart and removed for social distancing requirements. We will have a sign-in sheet as you walk in to assign you to a space to work. Feel free to reserve a spot in advance by calling me at extension 6268. 2 people will be allowed in the shop at a time. There will be a list on the bulletin board outside of the studio to sign up for 3 slots a day in the wood shop. You may call me at extension 6268 if you would like to sign up. Social distancing in both areas must be observed at all times, and masks must be worn. There will be a table in the art studio and the wood shop with hand sanitizer and disinfectant wipes. Please use the sanitizer upon entering the space. At the end of your session, please put away all of your supplies and work in their appropriate places. Wipe down your chair, table, and anywhere else you feel is necessary with provided wipes. We have some nice art exhibits showing now. I hope you get a chance to see them. We have 2 new exhibits in the Mellon Gallery, the Resident Photography Club and Jasmine Mason. Our residents have been busy taking wonderful pictures around campus and are also sharing lovely work from past excursions. Jasmine Mason works here in dining and just graduated from Henrico High School's Center of the Arts. She was one of 16 National Gold Medal Portfolio winners in the Scholastic Art and Writing Awards. Her work is fascinating. I hope you will make your way to the gallery for this wonderful show. We also have 2 new artists showing in the November gallery. Michelle Murray Sloan's bold paintings are large and stunning florals. They are created with classic art techniques using a modern application. The clay artist in the November gallery is Amy Chaplin. She is the Fine Arts Director at Trinity School. Her work is striking and modern with a twist of an old world feel. I hope to see you soon in the studios or in the galleries. Next up is Lynne Mcclintock.
Good afternoon, everyone. Thank you for joining us. On Thursdays, we've been featuring Thoughtful Thursdays for you all, which is an opportunity for you to hear from our resident clergy. They're thinking and very thoughtful about what's happening in the world and here at Westminster Canterbury and what you might be experiencing. So today we have Reverend Canon J. Fletcher Lowe, Jr. So Fletcher, welcome.
Good afternoon. First of all, I want to express my deep appreciation for the extraordinary way in which our staff has been protecting us and providing for us. There's kind of a miracle going on here, and I'm just deeply grateful for being here as a resident and for the care that has been given to me and to my wife and to so many others of us. My text comes from the Hebrew Scriptures, from the New Testament, and from the Quran. Love your neighbor as yourself. You know, you and I, for the past few weeks, have found ourselves in a situation that we really didn't bargain for. We didn't bargain for a virus crisis that would lock us up for several weeks. Nor did we bargain for our nation's racial unrest following the unjust death of an African-American man. Yet here we are, in the midst of 2 pandemics. The one a health pandemic, the other a justice pandemic. The one cries out for a vaccine, the other cries out for systemic justice. As a person of faith, I cannot ignore either pandemic. In the Abrahamic scriptures, God calls me to love my neighbor as myself, whomever and wherever he or she may be. With the virus pandemic, love means taking personal responsibility to protect myself from potential exposure for my sake and for my neighbor's sake, here and elsewhere. With the justice pandemic, love calls me to be open to and sensitive to the peaceful protests calling out for justice for my African American neighbors. As a white guy, that may be more difficult, but equally as necessary. Let me share with you something that I have come to understand that is important for me if I want, in God's name, to work for racial justice and love my neighbor as myself. Neither my father with me, nor me with my son, did we find it necessary to have, quote, the talk. What is the talk? It is what most every black parent has with his or her children. One focus of that talk is about driving the car. It goes something like this. When, not if, but when you are pulled over by the police, raise your hands up over your steering wheel. If the officer wants to see your driver's license, respond with courtesy that it is in your pocket or your pocketbook. If they ask for the car's registration, say it is in the glove compartment. Either motion could be and has been interpreted as reaching for a weapon. One of my black friends has wanted to give her sons lanyards to wear around their necks with both the car registration and their driver's license attached, wherever they drive. Ask a black parent, and they will say that their anxiety is not resolved until their child reaches home safely. My sense is that we will have overcome the justice filter when black parents no longer have to have the talk. My responsibility as a person of faith in loving my African American neighbors is to work to see that day come to an end. Let us pray. From the New Zealand Episcopal Prayer Book. God of the present moment, God who in Jesus stills the storms and softens the frantic heart, bring hope and courage to all who wait or work in uncertainty. Bring hope that you will make them equal to whatever lies ahead. Bring them courage to endure what cannot be avoided. For your will is health and wholeness and justice. You are God, and we need you. Amen. Stay safe, stay well, stay grateful.